welcome to you. My name is Dr. Nora Vyas, and I'm an Associate Professor of Psychology. And today we're going to talk about the latest COVID-19 variant. I'm joined by Dr. Bharat Pankhania, who's an infectious disease expert, regularly featured on BBC and Sky News. Dr. Pankhania is a senior clinical lecturer at the University of Exeter Medical School and has over 20 years' experience with communicative disease control and infectious disease management. Dr. Pankhania, it's such a pleasure to have you on our show. Welcome.
My pleasure. Thank you for asking.
Dr. Pankhania, the new strain of the coronavirus has emerged very recently. Can you share with us what this means exactly?
Yes, so these RNA viruses, which the SARS-CoV-2 virus is, a family of the coronaviruses, whenever they reproduce and multiply, they make mistakes. And usually the mistakes are 1 or 2 per month. In other words, the coronavirus is pretty stable. It makes mistakes, but it doesn't make many mistakes. What we have found is that a new lineage has emerged of the SARS-CoV-2 virus. And with this new lineage, we have noticed that it has multiple, what we call mistakes or mutations. And the multiple mistakes, mutations are also at critical points on the spike protein of the SARS-CoV-2 virus. As a result of these mutations, mistakes, as you want to call it, at critical points in the spike protein, a number of things may happen as a result. One, the virus may lose its efficacy to infect, or it may, in fact, increase its potential to be more infectious. Sometimes it becomes more disease-causing. Sometimes it becomes less disease-causing. In this instance, we have a new, what we would call a new variant, a new lineage of the SARS-CoV-2 virus. It is a bit like a large tree which has developed a branch, and then that branch has become the main trunk. So at the moment, what we do know is that in the southeast of the country, London included, a lot of people have been infected with that one lineage branch of the SARS-CoV-2 virus, the mutated lineage. And the good news is it is not causing more severe disease. Unfortunately, it is not causing less severe disease either. And what we think is that it may be more infectious, especially as the mutations are at those critical points where the virus attaches to the human ACE2 receptor. So as a result of those mutations at the critical points where the virus attaches to the human cell, it may be, and I use the word advisedly, it may be more infectious. In other words, easy for it to connect, easy for it to latch on to the human cell. And once it has latched on, it can inject the RNA into the human cell and then do what an infection does with such a virus.
It's really informative, Dr. Pankhania. So this new strain seems to be getting pretty much out of control, and there's been lots of research suggesting that 70% of this particular strain is more contagious. So in what way is it more transmittable exactly?
So again, it really is at this point in time, two schools of thought. One, that it attaches itself more precisely, more easily. It has a greater affinity for the ACE2 receptor. That's the receptor to which the SARS-CoV-2 viruses attach. And as a result, it finds it easy to infect humans. But I would also like people to understand that we may have all these people infected with this one predominant strain because we have been out and about, shopping, going to pubs, restaurants, crowded transport, going to the office, interacting, dropping our guard. So whilst we have a new strain in circulation, the key point is this is failure of infection control. So people have got infected because they have been in positions to get infected, and they have not perhaps followed the three critical C's, the C's of closed spaces, meaning indoors, and we are a lot more indoors because it is the winter period now. So closed indoors, crowded and closed indoors, and a lot of people and in close proximity to each other and in a closed environment, those three C's. And with those three C's, we can get more spread of infection. And maybe those are also equally viable reasons for why people are infected with this strain of the virus. It's the lineage of the virus.
And is there something we can do as a society? Maybe there needs to be the tightening of some of the recommendations. We are washing our hands, we're keeping the 2-meter distance, we're wearing a mask. Do you think there needs to be like an enhancement in terms of maybe there needs to be an increase in terms of our social distancing, maybe beyond 2 meters? Do you think that will help?
So what is critical is that this is a person-to-person spread of infection. And as a result, if you interact with many circles of human beings, you're increasing your chances of getting infected. In addition to that, we really need to continue with our infection control measures, which are in a place where there are other humans present, you wear your mask, and you must wear your mask properly, fully covering your nose and mouth, fitting snugly, not on your nose, not on your chin, not loosely attached to your face, tightly attached to your face, fitting snugly, and covering your nose and mouth properly, and use a multi-layered mask as recommended by the WHO, a water repellent tight weave fabric on the outside, and then an inner layer of absorbent material, and then another layer also of absorbent material tightly fitting around your nose and mouth. So those are good, straightforward, standard infection control measures we should take, as well as when you are indoors in an office setting, in a public office, that sort of thing, you must increase ventilation as well. Ventilation, because this virus may spread in a aerosol route, and if you dilute it with the intake of fresh air, you're reducing the amount per given volume of air in an enclosed space, and therefore we hope that you won't get a large enough dose of the virus that infects you.
Talking about infections, I now sort of want to talk about the vaccination program. So as we know, within the UK, there has been the emergence of the vaccination program using the Pfizer vaccine. Will the new strain or mutation interfere with the efficacy of the vaccine? Or is this vaccine able to protect us from such mutations?
Yes, so we don't think that the mutations, which are whilst in 17 or so places, it isn't a gross distortion of the spike protein, and therefore the current vaccines will work against the new lineage of the SARS-CoV-2 virus as well. And we've had that also affirmation from no one less than the chief executive of the vaccine manufacturers, also saying the same thing, that we expect that the vaccines will work, and we also therefore expect that our immune system for people who've already had the infections will be able to act against the arrival of the new lineage SARS-CoV-2 virus. But one thing we definitely do as part of our watchfulness is we look for people actively if they are getting a second infection from the new variant of the SARS-CoV-2 virus now in circulation.
Great. And how has this been assessed? So if you do find that, let's say, if someone's got a variant, do you think that they would be in isolation for still 10 days, or do you think there should be an extension of that?
No, no, no. The infection remains the same as per the original SARS-CoV-2 virus. So it is 10 days for a case to be out of circulation and 14 days for a contact of a case. The 14-day exclusion period is especially important in a healthcare setting, healthcare assistance for nursing homes, care homes, hospitals, those sort of critical sensitive places. The government has decided in other settings to reduce the quarantine period to 10 days. So in less mission critical settings where people are not very vulnerable, liable to severe infection, were they to get it, it has been reduced to 10 days. It may result in better compliance with 10 days, but the gold standard for quarantine is 14 days.
Thank you, Dr. Pankania. And in terms of the new strain, there's been evidence that suggests that children are equally susceptible as adults and are less inhibited based on this strain. So what is the impact of this new variant on children?
We will find out. We will find out if children get infection from this virus lineage more easily, if they are more likely to have signs and symptoms of illness, and if they are more likely to readily transmit that infection to other children, to their parents, grandparents, and their school teachers. This is something we will find out in due course.
Thank you so much, Dr. Pankania. It's been a pleasure speaking with you. Thank you very much.
Thank you. My pleasure.